Good morning, everyone, and welcome to today's Periodontology MSc Virtual Open Day. Thank you for joining us. My name is Nancy Gerges, and I was one of the students on the MSc program. I just finished last June, thankfully. We hope the session will address the course-specific questions you may have, and will help you to gain an insight to what it's really like to study on this MSc program. I'm delighted to introduce today's speakers. So first of all, Professor Jacopo Butti and Dr. Imba Yugav are with us today. They will provide an overview of the Periodontology MSc program, and then that will be followed by a Q&A in the second part of the event. The session will be recorded, so it started recording now, and it will be available on the website. So if you want to go back and refer to anything on there, it will be available. So first of all, I'd like to introduce Professor Jacopo Butti. He's a professor of periodontology at the UCL Eastman Dental Institute and an honorary consultant in periodontology at the UCLH Eastman Dental Hospital. He's a clinical specialist in periodontics and a member of the Royal College of Surgeons of Edinburgh. Jacopo is the program director of the MSc in Periodontology, the distance learning at the UCL Eastman Dental Institute. Also, Dr. Imba Yugav is a clinical lecturer in periodontology and the deputy program director of the course. Imba is actively involved in teaching in postgraduate programs, both MSc and MClin Dent in periodontology. She also oversees clinical training and supervises a diverse range of research projects. So over to you, Jacopo.
Good morning, and thank you, Nancy, for the introduction, and thank you for be able to join this session this morning. So I'm gonna share my screen and just to make sure that everything works fine. Okay. Can you see my screen correctly?
Yes, all clear.
That's good. So yeah, good morning again. So thank you for joining this session. This is our online event where we try to give you a brief overview of the MSc in periodontology, of which I am the director. So then will be some time at the end if you want to ask me any questions. We also have a face-to-face event coming soon on the 20th of November, if you wish to have some sort of face-to-face contact with us. So regarding this MSc, this is the team, at least the main player of the program. But however, we are part of a much larger unit. So there is a variety of staff members that at different time and in different format teach or help with the actual delivery of the teaching and exam for this program. So the one in the middle is myself and Imba. We are all connected, and then we have our program administrator, Marianne Norfolk, who might be able to pop in at some point to introduce herself. In terms of the program, the structure of the program is a blended learning, meaning that there is a large component of the delivery of the teaching which is online. But there are some residential week, so there are some block compressed the time during the year where we deliver face-to-face, predominantly lab-based teaching in our facilities. So it's a 3-year program. So if completed, students will achieve an MSc degree. But there is a possibility to exit the program at different level after 1 year as a certificate, after 2 years as a diploma, or again, completing the program with the MSc. The program ran between the end of September and typically around mid-June when we complete the final year exams. And it's got altogether 8 compulsory modules for the total of 180 credits. The structure is essentially 2 years of teaching. The last year is focused on the development of a dissertation project. So for the year one, for the certificate year, we have the focus of the teaching is setting the scene and the basic knowledge of periodontology. So we covered in 3 modules scientific aspect of periodontology. That's the scientific basis of periodontology module. And then we have 2 modules that are more clinically oriented, the periodontal diagnosis and treatment planning and the non-surgical periodontal therapy. So this module essentially focus on give a good understanding, knowledge, and practical skills of managing the initial phase of periodontal therapy, so the non-surgical component of the treatment, up and until the planning for the next phase, the so-called corrective phase of therapy. So as part of the year one of the certificate, there are 2 residential weeks. They normally happen, the first one end of October of the year one, and the second one around February. So the idea is that the teaching, sort of the theoretical component predominantly happen online, and then there are clinical practical aspects that are discussed during the residential weeks. The second year is the diploma. This is a quite intense year, I would say, and cover a variety of things, as you can see here. So there are, the first part of the year, there are 2 modules. One is more research-based, which is the evidence-based healthcare. This is a module that gives some fundamental knowledge on aspect of research, study design, methodology related to the development of a research project, a different level of study, critical appraisal of paper, and so on. And this module form the basis and the basic knowledge for the year 3 of the dissertation. Then we have a module which is called complicating factors and other oral conditions. So this module includes a good number of different things, but essentially the aim of this module is to incorporate the management of periodontal case with some sort of complicating element. This can be a complex medical history or a complex interdisciplinary aspect of the periodontal management, oral medicine element, and then again the relationship with the management of our patient. Include also aspect of governance, so audit. So it's very articulated, a complex model. Give you the idea is give an understanding of not managing the sort of conventional standard, if you pass me the term, periodontal patient, but the patient that might have other things, other important aspect to consider. And then there are 2 modules that are more sort of surgically oriented. One is the surgical periodontal therapy. So this module is about having the predominantly the understanding and the knowledge of option available to manage a patient following the initial phase of non-surgical therapy. So this includes an overview of the most important surgical techniques, include mucogingival therapy, regenerative therapy, resective crown lengthening. So an overview of all these aspects, and an understanding of the indication to different type of surgery, the factors that play a role in that. And during the residential week, we cover clinical aspect related to how to this, technique related aspect on flap design, suturing technique, and we will discuss a little bit later on about this. And then we have an implant module, which is not focused or aimed to give a comprehensive preparation on every aspect of implant therapy. This is beyond the scope of this program, but have a good understanding of how to diagnose peri-implant disease, how to manage peri-implant disease, what are the key aspects to consider in the management of an implant patient. All of these things are covered by this module. This week include a one residential week in March, where we go one by one, day by day, in the lab, doing exercise and teaching on different surgical procedure. And the year 3, as I was saying, this is about the development of the dissertation project. This is a different way of teaching compared to the year 1 and 2. Is a more independent, more sort of self-driven knowledge. However, there are still there is one residential week, but in effect is almost 2 residential week, because this is split in 2 different time points, one in September and the other one in February, during which we provide the fundamental aspect of you know, again, how to design a project, how to write a project, how to analyze data related to the project, how to, you know, write the result of this analysis, and so on. So it's a different year, but also offer the opportunity to experiment real life research in clinical practice, and I'll come back on this later on. So as I was saying, this is the way in which the teaching is delivered is a combination of online activities. Then there is a variety of them. There are webinar, there are drop-in session, there are case presentation, there are quizzes, there are unseen cases where we provide some clinical case for diagnosis and treatment planning. There are sessions where we discuss feedback about exercise that students have been doing during the modules. So there is all of these variety of teaching episodes in different formats. There is also a clinical component. So alongside all this online activity of teaching, students are asked to routinely treat periodontal patients. This is a model of distant supervision. However, there is a need to keep a clinical logbook, as well as prepare clinical cases for the actual exam, but also for other case presentation or formative assessment that we have during the year. So the main location of all the teaching material is Moodle. Moodle is our virtual learning environment. And essentially each year has its own dedicated Moodle page. You can see here for year 1, 2, and 3 for certificate, diploma, and MSc. And the structure of Moodle, the way in which the program is structured is such that the material for each individual topic or block of teaching is released normally once a week on the Monday morning. So every Monday morning, there is a new element of teaching that becomes available, and these include a variety of activities. So I'll give you an example. For instance, this is the one of the week of the program. So this is the typical structure that you will see on the virtual environment. So there will be an initial page that explain what are the learning outcomes and the requirements for the week. For example, in this case, this is around periodontal wound healing. So looking at the knowledge of the different phase of wound healing, histological aspect, different type of healing based on the different type of treatment modalities. And then we have a section where you have the learning material. This is typically divided into a reading list. A reading list is a selection of key papers that you will find there that you know are essential for the knowledge, plus a selection of sort of additional optional paper where you can expand on other aspects. There is normally some pre-recorded video, either lecture or webinar, where again we provide the essential aspect of the teaching in relation to the topic. And then there can be some sort of what you see at the bottom as formative assessment. So pretty much every week there is some sort of exercise. Some are very simple, like quizzes. Others require a little bit more work. For example, it can be preparing a series of paper for a literature seminar, or can be preparing a clinical case for a presentation in front of your colleagues, and so on. So there is routinely some activity which normally these give a bit of time to prepare, depending on the complexity of the task. It might be a few weeks, 4 to 6 weeks, for example, to prepare some of this task and submit that on Moodle. So this is an example of the reading list, where we highlight the reference textbook, which is for us the Jan Lindy, Clinical Periodontology Implant Dentistry, plus, as I was saying, a series of scientific papers that are tailored to the key aspect of the week. So alongside your activity, of course, there are different forums that you can find on Moodle. One of these is what we call the clinical forum. Essentially, this is a space where you can ask clinical questions in a more informal way, of course, maintaining confidentiality and basic GDPR rules. We provide advice in terms of clinical support somehow on clinical queries that you may have on a daily basis for your patient. Yeah, so this is an example of type of question that can be present in the forum. I would say there is an important clinical aspect in the program. So in order to progress with the program, there is a need to routinely see patient with periodontal needs. Of course, we appreciate that every practice or every setting is different. So therefore, there is a large flexibility in terms of the type of treatment that can be logged into the logbook. This is just some screenshots. This is an online page that we have developed and actually renovated quite recently, where with a sort of easy point and click interface, you can add the routine sort of visit that you do in your practice or in your clinical setting. For example, patient come out for a baseline assessment, you can simply click some of these options and then record your entries, your appointment on the logbook. So over the year, we expect every students to complete 100 entries, not 100 patient, but 100 episode of interaction, visits that you have with your patient in the practice. Okay, and this is also opportunity to reflect on your activity in your clinical setting. So this is sort of in general, yeah. So just going back to the clinical logbook, this is alongside specific clinical cases that will need to be prepared with a comprehensive presentation of the case. So I'll come back in a minute on that. So we said about the certificate year. So let's see a little bit more in depth what is the content of this year. So some of the key features are understanding and learning how to assess a periodontal case and how to present this. So looking at interpreting the clinical presentation from a periodontal, with a focus on a periodontal point of view, how to describe the tissue from every aspect in terms of the soft tissue, the keratinized tissue, the recession elements, the appearance of the tissue, any alteration of the normal anatomy, and so on. Then we have dedicated teaching on radiography. This is specifically to be able to appreciate periodontal aspect of dental radiography, but not only that, how to describe and report X-ray, focusing, for example, the pattern of bone loss, the presentation of the disease, the type of resorption, type of defect that you can have in a periodontal patient. So you have dedicated training online and during the residential week. Photography, this is another key aspect that we go through over the year one. So during the residential week, we have dedicated session of dental photography. Again, this is a crucial aspect for learning, but also for presentation in clinical case exam, and who knows, in conference moving forward. So this is one thing that we really focus on. We provide teaching on how to perform a clinical periodontal assessment. So there are sessions where either online and as well as face-to-face during the residential week, we go over how to complete a full periodontal chart, or how to probe around. So there are some clinical exercise also working on each other. So this is a short video, just giving an idea of what type of online material you can find. So I'll play for a bit.
Okay, we have 90, 70, 60, 70, 50, 70.
So this is, sorry, just let me just go back. So this is the type of material. Again, sorry, it was a bit clunky now going on streaming, but that type of material and the chart and how to perform that. And then we repeat this as an exercise as we go along in the residential week. Again, this is another example of video here when we start discussing about periodontal probing. There are some online sort of short clips where initially we introduce the probing technique, the pressure, the angulation, and so on. And then once, you know, this is being sort of delivered online, then during the residential week, we sit down on models and working on each other to sort of make sure that we are calibrated and able to perform consistently and effectively and accurately periodontal probing measurement. Okay, so this is just some of the example. Another key aspect that we spend quite some time on is the periodontal diagnosis. Of course, we discussed the classification introduced in 2017-18 by the European Federation of Periodontology and the American Academy of Periodontology, and the implementation of the BSP, the British Society of Periodontology. So flowchart like this, which you might be familiar with, will be discussed in depth with a view of calibrate ourselves on how to diagnose, how to screen a patient for periodontal problem, and how to diagnose and classify a patient with periodontal disease. Prognosis, this is another aspect that we focus on. Prognosis is crucial for our treatment planning. So this is what these slides that you see here is an example of a formative task, formative assessment that is present in the Moodle page when we discuss prognosis. This is a case that is given to students with sometimes a few weeks to work on, and a photograph, a radiograph, a clinical chart of the area, and then formulate a prognosis. And then after that, we have an online session where we discuss about this case and how, again, to become confident on a few prognostication systems that are in use for periodontal patient. Instrumentation, of course, this is a central part of the year one of the training. So again, here another clip where we show the morphology and of a Gracie curette. And alongside that, we discuss about all the different type of instruments, and we discuss about operator and patient positioning. We discuss about instrumentation technique, positioning of a curette inside the pocket, different type of strokes, different type of instrument for different type of surfaces, all the aspects that are relevant for our daily practice and managing patient with periodontitis. Again, here is a short clip of instrumentation technique. This will be extensively discussed during the practical session in the lab in the residential week. So this will be complementary to the practical teaching that we deliver. We were talking about presentation of clinical cases. You see here a few screenshots taken from the template that we use and we want all the students to use when they present the clinical case. So this is a template that we use across our online program and full-time program. And as part of it, you can see there is a area where you can provide information of the periodontal chart, baseline and follow-up photographs, and a specific way to present your extraoral, intraoral picture, how to report on a radiograph, as we were discussing before, how to report on prognosis, how to detail an initial treatment plan for a patient with periodontal needs. So this presentation in the year one, the students are expected to all together to present 3 clinical cases, 1 cases up to and including the initial treatment plan, and 2 cases up to and including a reevaluation following the non-surgical periodontal phase of therapy. And these will be exam cases that will be assessed during and at the end of the academic year in order to progress to the following year. This is some of the photos that we have one of our groups during a literature seminar on plaque control. This was a discussion session that we have during our residential week. So some key aspects of teaching that we feel are important to discuss face-to-face are incorporated as well in the residential week. And there are opportunities to present paper and discuss the evidence on specific topics. These are some images taken from the residential weeks again. So what you see in this picture is our year one cohort working on each other on our level 2 at the Rockefeller building, where we are based. On the level 2, we have 8 dental chairs, and that's where the teaching on probing, on practical skills, so instrumentation, and on dental photography, for example, happen. So you see here the type of activity that we do. And this week is really to make sure that you go back to your practice and able to comprehensively assess and treat a patient for the initial phase of therapy. This is our labs. So these, again, some photos from the 4th floor of the Rockefeller building. You see here we have, this is a quite new facility. So we have plenty of 88 bays with phantom heads, and we have specifically design periodontal models where we can practice with simulate periodontitis, periodontal disease and periodontitis and defect. So here is where you see some practical teaching on instrumentation happening in the lab. So this is essentially for the year one. So other things to mention before moving to the year two, alongside the all online teaching, and there are, again, we said there are episodes where we meet online, sort of live teaching session where we discuss, but there are also regular case presentation. This happened on a Thursday lunchtime, and our opportunity here to share case presentation with our full-time students, PhD, or specialty trainees that all join this lunchtime case presentation where we discuss and present clinical cases. So this is an opportunity also for regular case discussion from that point of view. And so moving to the year 2, this is the diploma year. As I said, there are different modules here. What I'm going to show you a few pictures here. This is just a little bit of background of our program. This is a program that started in 2019. So this was some picture of myself at the time and our program administrator at the time. As soon as we started the program, COVID hit. So we were in the awkward situation of not be able to deliver face-to-face residential weeks, amongst, of course, all the other issues that COVID brought. So we managed here, you see this box, to ship the instruments and the model in different parts of the world to all of our students, and we deliver practical teaching in streaming from our lab with the students working from their own home or practice with all the material. Challenging times. We hope that we don't have ever to go back to this model, but so you know that in case there is a problem like this, we have managed to somehow deal with that effect. These are some, again, of the initial recording session, again, during COVID time, pretty isolated, as you can see, filming and recording activity for the program. And once more, here you can see our labs. This is just before the start of our residential week of the year 2. So you can see some of the instruments prepared. So we have dedicated surgical kit. We have, again, of course, we provide advice, a recommendation of ideal setup for surgical therapy. And you can see here the setup, because we tend to record a relevant aspect of practical teaching, so you can go back and review some of this surgical technique, for example, incision technique, suturing technique, flap elevation, and so on. Okay, so you can see here some of the kits ready to go. So this is a short clip just to give you a taste of one of the moments during the surgical residential week in the year 2. So I'm just going to play this clip that show me sort of describing and discussing a surgical treatment planning. What about the 6?
Around the 6, I think, is like around 9-10 millimeters distal. Yeah, the pocket.
Okay, so what design would you do?
Maintain the paramarginal as well.
Maintain the paramarginal. So tell me, what if I'm doing a paramarginal here, then what do I do at this point? Carry on?
Carry on, and then maybe stop a little bit before.
Okay, so I'll stop here. Okay, so if I do my incision.
Yeah. Stop there. Yeah.
Stop there. Okay. Right, so this is just to give you an idea. So there is this kind of discussion. We go through step by step on how to perform an incision for a specific type of technique. We go through each step of the therapy and so on. So this is to give you an understanding of the surgical aspect. Again, this is, you can see here some of our periodontal models, which simulate the calculus, but also simulate the recession defect, simulate intrabony defect. So these are underneath these tissues, simulated periodontal tissue. There are, for example, intrabony defect or horizontal type of bone resorption simulated, so we can practice different technique. These again some screenshot when we were planning for root coverage procedure for multiple recession. And again, some screenshot of, performing incision, performing partial thickness type of flap. So this is on periodontal models. Other, screenshot where you can see the use of different suturing technique for periodontal regeneration following the placement of material. And of course, there is a lot of training using animal models, like using pig's head. So in this case, you can see a short video I can show you now where we discuss about a different type of suturing technique. Initially on a straight line, just so we understand the key concept of most of the most relevant technique.
We said we have done the horizontal external, with the same concept we could do an horizontal internal. So basically, instead of coming out on the same flap like we have done before, we enter, and then because it's internal, if you remember, in this case we go inside again, so we go on the other flap, okay, so this is the first part. Then we come back, but this time, because it's horizontal, again we move either more distally or more mesially, in this case more distally. We go in, okay.
Okay, so this is just to have a flavor of what type of activity we do. So there is, in this case, a step-by-step discussion of different suturing technique and how to perform that. So there is a demonstration typically first, like in this case, and then followed by some time left to go through the actual practice for each of the.
We said we have done the horizontal external, with the same.
Okay, so, and again, these are other screenshots from there. For example, here you see the design of a flap with 2 vertical releasing incision, where we can also practice different type of flap thickness, full thickness, partial thickness, like in this case on the picture on the right, where you can see the different layer of the flap. Also, you can see in this case, you know, extraction socket and so on. So these are all the type of activity. Here are some other screenshots when we discuss about mucogingival surgery. We discuss about how to harvest a soft tissue graft from the palate. We cover the different technique, L-shaped, linear, or trapdoor technique, for example. And we have, in this case, the pig jaws to practice this technique, and how to manipulate the graft outside the mouth, how to thin the graft, as you can see in the picture on the left. Again, this is some other videos that are available. So we have in turn over the years different type of external lecturer helping us or delivering some specific teaching on some aspect. This, for example, a discussion about again mucogingival type of technique. So I'll just show you a brief clip of
Did everybody understand that? Or anybody still have questions? Because that's a very important concept, and it's actually key in terms of the stability and the healing and the aesthetic outcome. So if anybody didn't have it very clear, we can repeat it again.
Can you repeat it, Eva?
So what Roberto was saying is about the design of the trapezoid, yeah, of the flap for your single incision. So you can either do, as he described, a triangular. So your vertical incisions will end into a triangle, into a very thin line. The other option is going to be when you have like a more trapezoidal. And the differences between the two are going to be where you adapt your papilla at the end of it. Let me see if I can do a small drawing of this. and that may be a bit more clarified.
Thank you.
No problem.
Okay, so here you can see the execution of a flap for with coverage procedure, with 2 vertical incision, again creating a trapezoidal flap, and then step by step how to mobilize the flap, how to then advance the flap, and so on. Okay, so I'll stop here for that. This is again another situation, again variety of teaching over the years. This is a session we had during I think it was actually during COVID time, or not maybe at the beginning, but 2020, 21, where one of our external, Professor Rotundo, delivered a live surgery from his practice, and then on streaming we could follow and students could follow the procedure. This is after having done the practical teaching of models. So I'll again show you a brief clip of this, so you have kind of an idea of again different aspect of teaching on the same topic, mucogingival surgery. Here we have, you can see a phase of the live surgery where there is a disepithelialization of the anatomical papilla to facilitate the adaptation, coronary advancement adaptation of the flap for a root coverage procedure on a lower tooth. So again, this is during these moments, there was a possibility, of course, to ask some questions, and certainly afterwards to discuss some of the aspects that were relevant to the specific surgery. So as you can see, I just want to give you a flavor of different elements: teaching on models, teaching on pig jaws, a short video where we describe the technique, and sometimes we have meetings with external speaker that either they provide specialist opinion or specialist discussion on some topic, or sometimes we have a live episode for that. Okay, so let's move on. I think overall, I would say is there are opportunities also to really enjoy that. Of course, there is it's not an easy ride, I would say. Probably Nancy can confirm that, but can be quite intense, especially in certain period of the year. But is also is often a great opportunity to bond with your colleagues, meet people from every part of the world. Our program is open to worldwide, so there is really opportunity to form friendship and links with other people, or even professionally share different reality of managing periodontal patient, for example. So there is a huge opportunity to discuss and enjoy the activity that we do. A little bit about where we are. So in these slides, you can see our 2 main buildings. So the old Eastman, used to be in Grazing Road, now is moved, and as the move happened in 1920, we have 2 different sites which are really close to each other anyway. One is the Rockefeller Building, which is in University Street, so really central in London, very close to the main UCLH hospital, Houston, so really central, a very good location. And next to it, there is the Eastman Dental Hospital, which is now merged with the ENT Hospital. So we have a Royal ENT and Eastman Dental Hospital, which are in Huntley Street, again, right around the corner from the university. This is just a short clip, but you've seen the labs. This is one of the clips of the dental lab floor. As I said, since we moved 2019, it was all fully refurbished, so it's really a brand new facility. This is a 3D rendering, the construction of the lab. and again, just to give an overview of what are the facility here. Okay, this is now a few years, but when we are actually ready to move to the Eastman, that was the sort of first taste that we have of this new setting. And of course, this space is used not only, so we share teaching across the Eastman, other courses. So there is, I haven't said that, but a lot of opportunity of networking as well across other disciplines, other programs. Okay, so I'll just stop this here. I just wanted to give you a bit of an overview of that. And again, this is another short video that's mainly to show you the facility where we perform the practical teaching, working on each other during the residential week. So you might, I don't know, some of you might have seen this because it's one of the part of our promotional video, but I just want to quickly go through it. So you have a feeling. This is me, as you can see, teaching with some of our students. This is a discussion about operator patient positioning. And again, close observation of how to position Gracie instrument, how to select the instrument, how to achieve a correct resting position, how to perform a different type of strokes for non-surgical periodontal therapy. Okay, this is our facility. That's really nice environment of the level 2 of the Rockefeller building. So this facility have got also, new microscope. There is possibility of video recording. It's very nice space. This has been fully refurbished when the Eastman moved to the Rockefeller building. There is a nice space where we can discuss following the practical session. We have area where we can interact and have a sort of briefing or post practical discussion. So you see some of the camera that we have, so we can follow practical exercise across. Okay, so this is just to give an idea of course, there are opportunities for social. We always enjoy some sort of time out together. These are some pictures taken when we during one of the residential week. I'm always late for this, but yeah. These are some other screenshots just of our groups over the year. The first one you see in 2019 was still the old and beautiful Eastman Dental Institute in Grazing Road. Now it's no longer like that. Only the face, the front of the building is remained, but the rest are pictured that, the one below 2021 is the entrance of one of the entrance of the Rockefeller building. And then it's another picture with all together. One of them is the graduation of the first cohort of our MSc. As I said, we are part of a larger team. This probably with all these pictures, some of the staff is no longer with us, but there is, as you see, a long list of names that in different way contribute from the academic point of view. Plus we have staff member from the hospital has also helped some aspect of teaching in our program. And this is some of the social event of conference picture that we have done over the years. And again, this is in the old Eastman. We have also an online sort of social media presence. This is the Instagram page for the Perio MSc. So please follow that if you want to have some updates on what's going on over time in relation to the program. And you will see some, again, photos and videos of our program. Okay, that's really it from my side regarding the overview. I maybe just a couple of comments that I always make regarding this program, just to make sure that everyone is clear when is considering applying for this. This is a program designed for what they call for the NHS a level 2. So it's been designed with in mind the skills and competence of a dentist with a specialist interest in periodontology, and not a specialist. It doesn't mean that we don't cover aspects, as you have seen, of specialty management of periodontal cases. We do that, but as such, this program doesn't have the sort of the possibility to apply itself to a specialist list or a college exam. From that point of view, although there is in progress the definition of a college exam for level 2 perio, so that's will be happening the next few years or months or years as I speak. So this is in the other questions or the other comments to make. So applications are open and will remain open normally until July. But if you are interested in applying, it's better to do it sooner rather than later, because we go through a recruitment process sort of in stages. So we aim to have a maximum of 10 students per year normally. So it's important, if you are interested, to apply soon, or in any case, get in touch with myself or Imbar. So I didn't put my email on, but I'm happy to, if you want to contact me. My email address is j.buti, B-U-T-I, @ucl.ac.uk. And I'm happy to answer question separately, or to meet if you prefer to have you know, a one-to-one conversation before applying to this program. Okay, that's really it from my side. So thank you very much for listening, and I just ask Nancy to coordinate if there are any questions.
Yes, thank you, Jacopo, for this very informative session. We have a question here. So Momina says that she's an overseas dentist and currently registered as a dental therapist in the UK. So she's asking if she can take on to this course while continuing working as a dental therapist here in the UK.
Thank you. Thank you for asking that. As I was saying at the beginning, in order to apply for this course and successfully proceed this course, you need to see and routinely treat periodontal patient, but as a dentist. So you will have to be working at least, I would say, 1-2 days a week as a dentist, because although the initial year is include predominantly non-surgical aspect of treatment, there is an element of overall treatment planning, and then moving to the year 2, there is a necessity of working as a dentist in order to fulfill that. Yes, so really we need that as part of the MSc Periodontology.
Okay, thank you, Jacopo. Are there any other questions? Okay, so I don't think there are any other questions. I think you've covered nearly everything in a lot of detail, so it's quite clear.
Yeah, not a problem. I was wondering if there is any comments from either yourself or Imbar, indeed. You want to add anything to my presentation, if there are no other questions before we close?
From my side as a student, I would say it's been a fantastic course. It helped me a lot with my career. So now I currently work as a dentist with special interest in perio, 5 days a week in 5 different practices. So it's quite interesting and exciting. And I've learned a lot. So I had a passion for perio before I started, but the amount of knowledge that I've gained through this course, and especially the surgical training was really helpful. Even the surgical training helped me in my non-surgical treatment, because you understand the anatomy, you understand the tissue, you understand a lot of things. And although I was not surgically trained at all before this course, I picked up my courage and I started doing a few surgeries, and they've gone well. So I'm quite pleased with the course. Third year is the dissertation year, quite a full-on year, but again, didn't have any experience in research before that, and it helped me tremendously, especially with speaking to patients and stuff, backing up your treatment plan with knowledge when you're advising the patient to have a certain treatment, when you've got the knowledge to back this up, especially quoting research and evidence-based and all of that. It makes a huge difference in how you communicate with patients. So, and I also got the opportunity to speak on 2 international conferences about perio, which was incredible. So I completely support this course, and they're not paying me to say this. It's a true statement. And if I can help in any way, please do also reach out. I'm happy to answer any questions.
Yeah, thank you, Nancy. I think, again, you're not just saying, I think you're hearing from Nancy, who's really, so far, has made the most of it in terms of, developing opportunities, again, to expand and make them, not only learn, but also try to, explore aspect of teaching or presenting at conference, which is really interesting. So again, I'm glad that you offered that. So if there is any question that you might want to direct to Nancy, probably she can give you a sort of less biased opinion than myself as director, of course. So thank you for that, Nancy, and thank you again for being here today. Imbar, is there anything you want to add to this?
Thank you, Jacopo, and thank you, Nancy. First, well done, Nancy. It's very exciting. I was hearing our former students and seeing where you've got, really well done. I think, Jacopo, you really explained everything. You showed how diverse is our program in terms of clinical, academic, research. We include everything. Really trying to support one-on-one in anything that you need. And for the busy clinician, I think this is the perfect program if you want to combine your passion for perio and still keep working. So I think this is
I think that's a good point. So I probably didn't stress that, but I think nowadays is probably a very good option if it's difficult to leave family business and stuff behind completely to do a full-time program. This will give you a good windows to still keep going and getting some knowledge and expertise in a specialist field, and then apply on a daily basis what you learn, and again, but without necessarily sacrificing a lot for a full-time program. Of course, as everything, full-time program will give you a more direct element of clinical practice and supervision. There's no question about that. But as a second best alternative, I guess this MSc can assist you if in your individual circumstance. So that's, I think, one of the key aspects probably that
I think this was one of the key reasons why I chose this course over the MCLIN Dent, is because of the fact that I can still work while I'm learning. And it did help me first with my cases that I was on the course. So when I have a complicated case, I always checked in with Jacopo and Imba if I'm on the right way. Is there a better way to deal with the case? Any difficult, cases to discuss with your colleagues and with your tutors. I think it helps tremendously. And then also, I think one of the key things was the fact that you can, there are like separate, different exit points. So you can exit after year 1 if that's what you want, or you can carry on with year 2. Many of the other programs don't offer that. You either sign up for the whole 3 years or you don't get anything at all. So I think this is one of the key advantages as well of this course.
All right, thank you very much. Thank you very much, everyone. And Imba, I think if there are no further questions, I guess we can close the session for today.
Yeah, so there are no further questions. So thank you for attending. And if you've got any questions, you can always reach out.
Thank you, everyone.
You. Bye bye.
Bye.